Let me tell you about a question I hear more than almost any other. It comes in whispered consultations, in anonymous messages, in eyes of men who can't quite bring themselves to ask out loud. It's a question wrapped in shame, comparison, and decades of misinformation. And today, we're going to answer it not with reassurance that dismisses your concerns, but with science, truth, and a perspective that might completely change how you think about intimacy, confidence, and what actually creates extraordinary sexual experiences. Here's what's really happening. Right now, millions of men are measuring their worth against a ruler. They're scrolling through carefully curated images, comparing themselves to statistical outliers and adult entertainment performers, and coming away with a story about inadequacy that has almost nothing to do with reality. Meanwhile, women are having completely different conversations about connection, presence, about partners who listen to their bodies. There's a massive disconnect here, and it's costing men their confidence and couples their intimacy. Let's talk about what women actually care about when it comes to size. Not what culture tells you they care about, not what locker room conversations suggest. The science shows what women consistently report and what creates genuine, profound sexual satisfaction. I want to start by acknowledging something important. Your concern is understandable. We live in a world that has taught men to worry about this particular measurement more than almost any other aspect of their sexuality. Adolescence onward, size becomes entangled with masculinity, adequacy, and worth. That's not irrational. That's cultural conditioning. Here's the thing about cultural conditioning. It can be completely disconnected from biological and psychological reality. Let me give you the foundation we need to understand this properly. The human body is an extraordinary piece of engineering. Sexual response in women involves far more complex anatomy and neurology than most people realize. When we talk about what matters in intimacy, we're really talking about nerve density, arousal physiology, psychological engagement, and the interplay between all of these systems. The clitoris contains approximately 8,000 nerve endings, more than any other structure in the human body, male or female, double the nerve endings found in the penis. And here's what most people don't understand. The clitoris isn't just the small external structure. It's an iceberg. The visible part is connected to extensive internal anatomy. The clitoral legs, the bulbs, tissue that extends several inches internally and becomes engorged during arousal. This architecture surrounds the vaginal opening and creates the primary source of sensation during sexual activity. The vagina itself is a different story. The vaginal canal has far fewer sensory nerve receptors overall, and they're concentrated in very specific areas. The outer third of the vagina, roughly the first 1 to 2 inches, contains most of the vaginal canal's nerve endings. This area is called the introitus. Pressure, stretch, and stimulation are most intensely felt. Beyond that outer third, the vaginal canal has progressively fewer sensory receptors. Think about it this way. If the entire vaginal canal were as sensitive as the outer third, childbirth would be even more extraordinarily painful than it already is. Evolution has actually created a design where deep sensation is relatively limited. Now, there are sensitive areas deeper in the vaginal canal, the anterior fornix, posterior fornix areas that some women find pleasurable when stimulated, but the density of nerve endings doesn't compare to the outer structures. And here's the critical piece. These areas respond more to pressure, angle, and rhythm than to sheer size. Partner who understands angles and pays attention to feedback can stimulate these areas far more effectively than someone who assumes depth alone is the answer. Let's talk about what happens during female arousal, because this completely changes the picture. When a woman becomes aroused, a process called vaginal tending occurs. The vagina literally expands and lengthens. The cervix lifts, the back of the vaginal canal balloons outward, and the entire structure prepares to accommodate. The vagina is not a fixed tunnel. It's a dynamic, adaptable space that changes dramatically based on arousal level. A woman who is highly aroused has a completely different internal anatomy than a woman who isn't. This is why rushing, inadequate foreplay, lack of arousal can make sex uncomfortable regardless of size, and why deep arousal and full engorgement can make a wide range of sizes comfortable and pleasurable. Here's something else anatomy teaches us women vary significantly in their internal structure. Some women have a shorter vaginal canal, others longer. Some have a cervix positioned more anteriorly, others posteriorly. Some women find stimulation of the anterior wall intensely pleasurable. Others prefer posterior pressure or lateral angles. This isn't standardized. There's no universal female anatomy any more than there's universal male anatomy. This means is that compatibility isn't about meeting some objective standard. It's about fit, angle, and the 1,000 subtle adjustments that attentive partners make. share what research actually shows about women's preferences. Multiple studies have explored this question using anatomically correct models that women could select to indicate their preferences. What they consistently find is fascinating. When asked about their ideal for a one-time partner versus a long-term partner, women on average select something slightly larger for the one-time scenario and something closer to average for a long-term partner. Here's what's more revealing than the averages: the enormous variation in responses. Some women preferred smaller sizes, many preferred average, some preferred larger. There was no consensus, no universal standard, and when researchers ask women to rate what factors contribute most to sexual satisfaction, consistently ranks far below factors like how attentive the partner is, how well they communicate, whether they prioritize mutual pleasure, their emotional connection, their confidence and presence, and the variety and creativity in their sexual repertoire. Let me put this in perspective with a clinical reality I see constantly. I work with couples where the man is objectively on the larger end of the spectrum and the woman reports chronic discomfort, anxiety before sex, diminished desire because intimacy has become associated with pain. I also work with couples where the man is smaller than average and the woman reports profound satisfaction and regular orgasms because her partner has become extraordinarily skilled with his hands, mouth, positioning, and attention to her arousal. Size in these real-world scenarios predicts nothing about satisfaction. Here's the mechanism that matters most. Female orgasm and satisfaction depend overwhelmingly on clitoral stimulation, either direct or indirect. During penetrative sex, often creates pleasure isn't deep thrusting. It's the pressure and grinding at the base of the penis against the clitoral complex. The angle that stimulates the anterior wall where the internal clitoral structures are closest to the surface, and the rhythmic tension and release that builds arousal. Many women cannot orgasm from penetration alone, regardless of their partner's size, because the mechanics simply don't provide sufficient clitoral stimulation. This isn't a dysfunction, it's anatomy. What does create extraordinary sexual experiences? Let me walk you through what actually happens in encounters women describe as deeply satisfying. It starts long before the physical act, with emotional presence, creating safety and anticipation with communication that allows vulnerability. Then there's extended foreplay that engages the entire body, not just the genitals. There's attention to arousal, noticing breathing changes, muscle tension, wetness, the way her body moves toward or away from touch. There's variety in stimulation, oral, manual. Different positions that create different angles and pressures. There's responsiveness when something works, continuing when something doesn't, adjusting without defensiveness. There's rhythm that builds and sustains arousal rather than rushing to completion. And crucially, there's presence, being genuinely engaged rather than lost in your own head, worrying about performance or adequacy. None of this requires exceptional size. All of it requires skill, attention, and confidence. And here's the paradox. The very anxiety about size often undermines the presence and attentiveness that actually create satisfaction when you're worried about whether you measure up. Fully present. When you're in your head comparing yourself to some imagined standard, you're not reading your partner's responses. When you're rushing to penetration because you think that's what matters most, skipping the very things that build her arousal to the point where penetration feels extraordinary. Let me address the elephant in the room. Yes, some women prefer larger sizes. This is true. It's also true that some women prefer smaller sizes because larger causes discomfort or pain. Some women are genuinely indifferent to size and care far more about other factors. Some women's preferences change depending on where they are in their cycle, aroused they are, or what kind of sexual experience they're seeking. Preference exists and preference varies wildly. Here's what women consistently say when researchers ask open-ended questions about what makes a partner exceptional. They talk about generosity, about feeling desired. Partners who are enthusiastic and creative, about emotional safety that allows them to express what they want. Men who don't treat sex like a performance, but like a shared experience. One more piece of science that matters here. Psychological component of sexual satisfaction is profound. Studies using both surveys and physiological measurements show that women's subjective arousal and satisfaction often don't correlate perfectly with their physical arousal. You can measure vaginal blood flow and lubrication and find physiological arousal, but if the psychological context is wrong, if she feels pressured, disconnected, like her partner is insecure and needs constant reassurance, her subjective experience will be negative. The reverse is also true when the psychological context is right, when she feels connected and desired and free to be fully herself. Subjective satisfaction can be extraordinary even when the physical stimulation is relatively straightforward. This is why confidence matters so much, not arrogance, bravado, but genuine confidence. The confidence that says, I know how to create pleasure. I'm going to pay attention to your body. I'm going to communicate. I'm going to make this about us, not about my anxiety. That confidence is profoundly attractive. It creates safety. It allows her to relax into her own arousal instead of managing your insecurity. So what does this mean practically? It means shifting your focus entirely. Instead of worrying about a measurement you cannot change, develop the skills you absolutely can. Learn her anatomy, not generic anatomy, her specific body. Ask questions. Pay attention to what makes her breath catch, what makes her pull you closer. Become exceptional with your hands and mouth. Most women require clitoral stimulation to orgasm. If you can provide skilled, sustained, varied clitoral stimulation, you can create extraordinary pleasure regardless of any other factor. Explore positions strategically. Different positions create different angles. Some provide more clitoral contact, some more anterior wall pressure, some deeper penetration. Learn what she responds to rather than assuming depth is always the goal. Master the art of building arousal. Sex is not a race. Arousal builds in waves. Learning to bring her close and then ease back, building tension over time, creates far more intense orgasms than rushing to the finish. Communicate openly. Ask what feels good. Tell her what you find exciting about her body. Create a dynamic where feedback is welcomed, not threatening. Work on your overall presence. Manage stress, anxiety, performance pressure. Be in your body, not your head. The more present you are, the more connected the experience becomes. Let me tell you what doesn't work. Trying to compensate with technique that ignores feedback, approaching sex like a mechanical task, avoiding intimacy because of insecurity, comparing yourself endlessly to others, using substances or devices that promise size changes but deliver nothing except wasted money and potential harm. None of these address the actual dynamics that create satisfaction. Here's a reframe that might help. Think about other areas of pleasure and skill. An exceptional chef doesn't need the most expensive ingredients. They need knowledge, technique, and creativity. An extraordinary musician doesn't need the largest instrument. They need skill, sensitivity, and practice. Sexual expertise works the same way. You're working with the body you have. Your task is to become extraordinarily skilled with that body, to develop the awareness and attentiveness that allows you to create profound pleasure for a partner. I want to address one more thing directly, the comparison trap. Entertainment has created a completely distorted picture of typical anatomy and sexual response. The performers are selected for specific physical attributes that are statistical outliers. The acts are choreographed for visual appeal to a camera, not for authentic pleasure. The female responses are often performed rather than genuine, and the entire context, lighting angles, editing, stamina enhanced by breaks, and chemical assistance is artificial. Comparing yourself to this is like watching Olympic gymnastics and feeling inadequate about your flexibility. It's not a reasonable standard. Similarly, the stories men tell each other, the locker room comparisons, the cultural mythology about size, most of it is exaggeration, insecurity, and misinformation compounding over generations. Women are not in their friend groups obsessing over penis size the way men fear they are. They're talking about partners who make them feel desired, who put in effort, who communicate, who are emotionally available. The conversation you think women are having and the conversation they're actually having are completely different. So where does this leave you? With a choice. You can continue to carry anxiety about something you cannot change, allowing it to undermine your confidence and your presence in intimate moments. You can recognize that you have been worried about the wrong thing and shift your attention to the skills, presence, emotional attunement that actually create extraordinary sexual experiences. This isn't about pretending size never matters to anyone. It's about understanding that it matters far less than you've been taught to believe, that preferences vary enormously, and that the factors you can control, your skill, your attentiveness, your communication, your confidence, are overwhelmingly more important. Every moment you spend worrying about measurement is a moment you're not spending becoming a more skilled, present, generous lover. Every ounce of mental energy directed toward comparison is energy you're not directing toward connection. The men who create the most profound satisfaction for their partners aren't the ones who won some anatomical lottery. They're the ones who have decided to become genuinely skilled, learn to read and respond to their partner's body, who have cultivated presence and confidence. Your task is not to measure up to some external standard. Your task is to become exceptional with what you have. And that is entirely within your control. The science is clear. The research is consistent. And the message from women themselves when they're asked directly about what creates satisfaction is unambiguous: be present, be attentive, be confident, be generous, communicate, and care about mutual pleasure. Do those things and size becomes largely irrelevant. This is the truth, not the comforting lie, the dismissive reassurance, the actual evidence-based, clinically observed truth. What you do with it determines everything.